Vaginal health changes after age 60. The human body is like a machine that continually changes throughout life, adapting to different life phases. Body changes with age are a natural and inevitable process. When entering the sixth decade of life, a woman's body undergoes significant transitions that affect many aspects of health, including the intimate area. These changes are often hidden behind embarrassment or taboo, yet understanding them is crucial for maintaining quality of life. Women after the age of 60 face various physiological changes that directly impact vaginal health. The drastic decrease in estrogen hormone post-menopause becomes the main trigger, creating conditions that need to be addressed with proper knowledge and strategies. Let's explore this biological phenomenon together and how we can address it wisely based on modern science and traditional wisdom. 1. Decreased estrogen and vaginal atrophy. The decrease in estrogen hormone is the main player in vaginal changes after menopause. This hormone is responsible for maintaining moisture, thickness, and elasticity of vaginal tissue. When its levels drop dramatically, the vagina experiences what is called vaginal atrophy or atrophic vaginitis. Vaginal atrophy occurs when the vaginal epithelial lining becomes thinner and less stimulated. Epithelial cells that are usually rich in glycogen decrease, causing a reduction in lactic acid production by beneficial lactobacillus bacteria. This condition changes the vaginal pH to become less acidic, creating an environment more vulnerable to infection. The impact on daily life can be very disturbing. Many women report discomfort, itching, and even pain during normal activities. Intimate relations can become painful, causing reluctance and potentially affecting relationships with partners. To address this condition, the first step is to recognize it as a normal process, not an embarrassing disease. Consultation with a gynecologist can help obtain medical solutions such as local hormone therapy in the form of creams or vaginal tablets. Natural solutions like water-based vaginal moisturizers can also provide daily comfort. 2. Vaginal dryness and wall thinning. Vaginal dryness is a common complaint experienced by nearly 50% of women after menopause. This condition occurs due to decreased production of natural vaginal fluid resulting from reduced blood flow and glandular activity in the area. The vaginal walls that are usually thick and folded become thinner and smoother. The layer of blood vessels decreases, causing reduced nutrient supply to the tissue. This thinning makes vaginal tissue more sensitive and vulnerable to irritation or small wounds during daily activities or intimate relations. The impact is not only on physical discomfort but also on psychological aspects. Many women feel less confident and experience anxiety related to this condition. Pain and discomfort can disturb sleep quality and daily activities. Practical solutions for this problem include regular use of water-based lubricants, not just during intimate relations. Vaginal moisturizers containing hyaluronic acid can help maintain moisture longer. Natural oils such as virgin coconut oil can also be used as alternatives, with a note that they should not be used simultaneously with latex condoms. 3. Changes in elasticity and tissue structure. Vaginal elasticity experiences a significant decrease after age 60. This change occurs due to reduced production of collagen and elastin, proteins that play a role in tissue resilience. The decrease in estrogen inhibits the regeneration of fibroblast cells that produce collagen. As a result, vaginal tissue becomes less flexible and less able to return to its original shape after stretching. The muscle structure around the vagina also experiences atrophy, reducing support and tone. The impact of these changes can vary, ranging from mild discomfort to pelvic organ prolapse in more serious cases. Many women also experience urinary incontinence, especially when coughing, sneezing, or laughing. To address elasticity problems, pelvic floor muscle exercises, Kegel, are highly recommended. These exercises help strengthen the muscles that support the vaginal structure and bladder. Consistency is key, with a minimum of 3 sets of exercises per day for at least 8 weeks to see significant results. Specialized physical therapy for the pelvic area can also be an option for those experiencing more serious problems. Specialized therapists can provide exercise programs tailored to individual conditions. 4. pH changes and infection risk. Vaginal pH change is another consequence of decreased estrogen. In women of reproductive age, vaginal pH typically ranges from 3.8 to 4.5, creating an acidic environment that protects against infection. After menopause, vaginal pH tends to increase to 5.0 to 7.0, approaching neutral. This change occurs due to decreased lactic acid production by lactobacillus bacteria, whose population decreases due to reduced glycogen in vaginal epithelial cells. The main impact of pH change is increased risk of vaginal infections, especially bacterial vaginosis and fungal infections. Many women report recurrent episodes of these conditions after entering their 60s. Symptoms such as itching, unpleasant odor, and abnormal discharge become more common. To maintain pH balance, it's important to avoid vaginal cleansers containing harsh chemicals. Just clean the outside of the vagina with warm water or pH-balanced soap specifically for intimate areas. Consuming probiotics, either in supplement form or fermented foods like yogurt, can help maintain good bacteria populations. Avoid using douching, internal vaginal rinsing, which can disturb the natural balance of vaginal microflora. This practice could actually worsen problems rather than solving them. 5. Impact on sexual life. Postmenopausal vaginal changes have a significant impact on sexual life. Many women experience decreased sexual interest or response, partly due to physical discomfort experienced. From a biological perspective, besides vaginal changes, testosterone levels that also decrease at this age play a role in decreased libido. Hormone receptors in clitoral and vaginal tissues become less responsive, slowing down the stimulation process and decreasing sensation. Solutions to this problem start with open communication with partners and health professionals. Using lubricants during intimate relations is a simple, effective step. Some doctors may recommend lubricants containing DHEA, a hormone precursor that can help improve vaginal tissue. Exploring alternative intimacy techniques and longer foreplay can also help overcome physiological changes. Sex therapy with professional counselors can be an option for couples experiencing difficulty adjusting to these changes. 6. Natural solutions and traditional medicine. Traditional cultures in various parts of the world have developed methods to address vaginal changes in elderly women. This wisdom is often based on the use of plants and special care practices. In Ayurvedic medicine, sesame oil is believed to have healing and moisturizing properties. Gentle massage of the external genital area with this oil is believed to increase circulation and nourish tissue. Traditional Chinese medicine uses herbs such as dong quai, which is believed to have estrogen-like effects. Modern research has begun to confirm some benefits from these traditional practices. Some studies show that phytoestrogens in plants such as soy and red clover can provide mild estrogen-like effects, helping reduce menopause symptoms including vaginal dryness. To try this natural approach, consuming foods rich in phytoestrogens such as soy products, flax seeds, and nuts can be a first step. Herbal teas from plants such as sage and black cohosh are also reported to help reduce overall menopause symptoms. However, it's important to consult with a doctor before trying herbal supplements, especially for those with a history of hormone-sensitive cancers or other serious health conditions. 7. Maintaining hygiene and daily care. Daily care becomes more important when the vagina experiences postmenopausal changes. Proper hygiene practices can prevent irritation and infection without disturbing the natural balance. Vulvar skin becomes thinner and less fatty after menopause, making it more vulnerable to irritation. Sweat glands and sebaceous glands decrease in activity, reducing natural protection against pathogens. For optimal care, use intimate area cleansers with balanced pH and free from fragrances. Avoid using regular soap, which tends to be alkaline and can irritate. After bathing, dry the genital area gently and avoid rubbing. Underwear choice also plays an important role. Prioritize cotton material that absorbs sweat and allows good air circulation. Avoid tight synthetic clothing that can retain moisture and heat, creating an ideal environment for microorganism growth. 8. Importance of physical activity and diet. Active lifestyle and balanced diet play important roles in maintaining vaginal health after menopause. Both affect overall health, including the intimate area. Regular physical activity increases blood circulation throughout the body, including the pelvic area. This increased blood flow brings oxygen and nutrients to vaginal tissue, helping maintain cell health and slowing the atrophy process. Specific exercises like yoga with positions that strengthen pelvic muscles can provide additional benefits. From a nutritional perspective, diets rich in antioxidants and phytoestrogens are proven to help reduce menopause symptoms. Bright-colored fruits, green vegetables, whole grains, and fatty fish contain essential nutrients for maintaining tissue health. Phytoestrogens in soy, flaxseed, and wheat can provide mild yet beneficial estrogen-like effects. Adequate hydration is also important for mucosal health, including the vagina. Drink at least 8 glasses of water per day to maintain overall body moisture. Avoid excessive consumption of alcohol, caffeine, and spicy foods that can exacerbate hot flashes and cause dehydration. Limit processed sugar that can increase the risk of vaginal yeast infections. 9. Herbal soak therapy for vaginal comfort. Herbal soak therapy is a traditional practice that has been used for centuries to maintain vaginal health. Some herbs have anti-inflammatory and antimicrobial properties that can help relieve irritation and prevent infection. The heat from the soak water also increases blood circulation to the genital area, helping tissue healing and revitalization. To try herbal soak therapy, prepare a herb mixture such as chamomile, 2 tablespoons, calendula, 1 tablespoon, and lavender 1 teaspoon, in 1 liter of hot water. Let the herbs soak for 10 minutes, strain, and add to warm water in a clean basin. Sit in the soak for 15 to 20 minutes, ensuring the vulvar area is well immersed. Do this 2 to 3 times a week for optimal results. Besides chamomile and calendula, sage and rosemary are also known for their healing properties. Sage helps reduce excessive sweating and has mild astringent effects, while rosemary increases circulation and has antimicrobial properties. 10. When to consult a doctor. Knowing when to consult with a health professional is an important part of vaginal care after menopause. Some conditions require medical attention and cannot be addressed with self-care alone. Extreme vaginal changes or symptoms that severely disturb quality of life could indicate conditions requiring professional intervention. Vaginal bleeding after menopause always requires medical evaluation to rule out the possibility of serious conditions. When to consult. If experiencing severe pain during intercourse that doesn't improve with lubricants, abnormal discharge with strong odor, vaginal bleeding after menopause, burning and itching sensations that don't improve with home care. Doctors can offer various treatment options, from local estrogen creams that are safe for long-term use by most women, prescription vaginal moisturizers more effective than over-the-counter products, to vaginal laser procedures that stimulate collagen production and improve vascularization. 11. Latest technology and procedures. Technological advances have opened new options for women facing postmenopausal vaginal changes. Several innovative procedures are now available with promising effectiveness. Vaginal laser therapy, such as Mona Lisa Touch or FemiLift, uses laser energy to stimulate collagen production and increase blood supply to vaginal tissue. These lasers work by creating controlled microtrauma that triggers the body's natural healing response. Clinical studies show positive results, with many women reporting significant improvements in moisture, elasticity, and reduction of pain during intercourse after 3 to 5 treatment sessions. Effects typically last 12 to 18 months before refresher treatment is needed. Radiofrequency treatment is another alternative that uses heat energy to tighten vaginal tissue and stimulate collagen production. This procedure is generally less invasive than laser with minimal recovery time. Although promising, these technologies are relatively new and require costs that are not cheap. Discuss with your gynecologist to evaluate whether you are a suitable candidate and whether the benefits are worth the investment required. 12. Building confidence and aging with dignity. The psychological and emotional aspects of vaginal changes are often overlooked, yet their impact on quality of life is as important as the physical aspects. Many women experience decreased confidence, anxiety, or even mild depression symptoms related to their body changes. Studies show that women who have a better understanding of physiological changes and accept these changes as a normal part of aging tend to experience lower emotional distress. To build emotional resilience, educating yourself about normal body changes is the first step. Sharing experiences in support groups or with peers can help normalize experiences and reduce feelings of isolation. Mindfulness meditation and self-acceptance practices have been proven to help women develop more positive relationships with their changing bodies. Reframing negative thoughts and replacing them with positive affirmations can strengthen self-image. Aging is a privilege not granted to everyone. Women who successfully adapt to body changes usually apply several important principles. Seeing changes as transitions, not endings, actively seeking information and solutions, and maintaining open communication with partners and health professionals. Conclusion: postmenopausal vaginal changes are a normal process experienced by all women. Decreased estrogen causes vaginal atrophy, dryness, elasticity changes, and pH shifts that increase infection risk. Although these changes are significant, various solutions are available, from special moisturizers and lubricants, pelvic floor muscle exercises, to local hormone therapy and the latest laser procedures. An integrated approach combining modern and traditional methods often provides the best results. A balanced diet rich in phytoestrogens, regular physical activity, and proper hygiene care form the foundation of good vaginal health after menopause. Most importantly, don't let taboo or embarrassment prevent you from seeking information and help. Discuss changes and discomfort with your doctor, as many effective solutions are available that can significantly improve quality of life.